The next speaker is Professor Laith Abu-Raddad, who is a professor of population health sciences and the director of the Biostatistics, Epidemiology and Biomathematics Research Core at Weill Cornell Medicine in Qatar. He will be talking about immune protection of COVID-19 vaccination and natural infection. Over to you, Professor Abu-Raddad. Thank you so much in advance.
Yeah, thank you very much for the opportunity and the invitation to speak today. It's really a pleasure and an honor. So today I will be speaking about key findings of about 2 years of research on COVID-19 epidemiology here in Qatar. So to start with, just a very brief introduction about the country. Qatar is a very small country here in the Middle East. It has a population of just over 3 million people. It has a very diverse population. So 90% of our resident population are expatriates coming from over 150 countries to work in very large development projects. Just like many other countries, we experienced several waves with COVID-19, starting with the original virus wave. Then we had an alpha wave when alpha was introduced. Then we had a beta wave, which is somewhat unusual relative to other countries. We never really had a delta wave. Delta was introduced when vaccination was scaled up to a large extent. So we had just a low incidence phase with delta. But then when Omicron was introduced, we had a very massive wave, as you can see here. And currently we are experiencing a small wave with BA4 and BA5. We are fortunate here to have national and federated databases for everything related to COVID-19. Whether it is testing, whether it is vaccinations, hospitalizations, everything, all of these are tracked at a national level. And we're fortunate with this because it happened that the country was going through modernization of its healthcare system. So advanced health platforms were actually implemented, and this just came exactly in the right time for us during COVID-19. Also, I think we are one of those countries where the academic sector and the government have quite a healthy relationship. And we work very closely with each other. So from the beginning of the pandemic, we worked with the government to structure also the databases so they are amenable to epidemiologic research. And this proved to be very helpful. Because, as I am an epidemiologist myself, so really what we need is really very good databases, which will allow us to design and implement a variety of the epidemiologic studies. So today I will be speaking about a number of these epidemiologic studies, and I will start with describing a few key results about what we have been finding about the natural immunity or natural protection that's due to infection with a pre-Omicron variant. A pre-Omicron variant meaning original virus, alpha, beta, or delta. So we have been looking at the protection against reinfection for all of these variants. And here is a result, it's a recent update actually, which very much describes what we have been seeing in terms of the protection against reinfection. So for those who had a prior infection, they were strongly protected against acquiring a new infection at an effectiveness of 86%. So the moment a person has a first infection, they were really unlikely to get a second infection. This all, of course, before Omicron. And this was really true for all of these variants. However, we start seeing some waning in this protection, but quite slow waning in the immunity. So the protection started at about 90%. And then we start seeing slow decline month by month. And after 16 months of follow-up in our national cohorts, the protection was at about 70%. So this, of course, suggested that we cannot really count on long-term immunity. In fact, we tried to model this waning of natural immunity protection. And it turned out the prediction is that it will last for about 3 years or so. So we're talking about an immunity that's really not long-lasting as opposed to some other viral infections. So we would expect quite soon for people to lose their immunity, and then they will be, of course, susceptible to reinfection. So this is all prior to Omicron. But then we had Omicron being introduced, So we wanted to look at the protection against reinfection. And here is also a recent update, which covers all Omicron subvariants that we encountered here, which are BA1, BA2, BA4, and BA5. It turned out for those who were infected before Omicron, they were protected at only 38% against reinfection. So as you can see, this is substantially lower protection that we have been seeing prior to Omicron. And this is why we saw lots of reinfections after Omicron introduction. We had a very large wave. And of course, all of this is due to the immune evasion of this new variant. Even more distressing is that we also saw very rapid waning in the protection of natural immunity against Omicron. So very much it only lasts for just over a year, as opposed to 3 years pre-Omicron. Really what we have seen is that Omicron have done two things in relation to natural immunity. The first thing, it reduced the level of protection to much lower level. We no longer have this protection at close to 90%, and also accelerated the waning in the natural immunity protection. So people are protected only for just over a year. So all of this really is telling us we really cannot count on natural immunity to protect us for a long time. And this, of course, will create fertile grounds for more waves to appear when people start losing their immunity. So this really in relation to natural immunity due to pre-Omicron infection, but what about natural immunity due to Omicron infection? So here is a summary of a few recent studies in this regard, where we looked at this protection, and it turned out that Omicron subvariants are strongly protective against each other. So BA1 is very strongly protective against BA2 at over 90%. BA2 is strongly protected against BA1, and both BA1 and BA2 are strongly protective against BA4 and BA5. So within this family of Omicron subvariants, we see very strong actually protection across them. But of course, we do not expect this immunity to last for long. Omicron was introduced only a few months ago. We expect with time we will start seeing also waning of natural immunity, and perhaps it will last just about 3 years. So all of this is in relation to the protection against infection. But of course, something of great interest is to see the protection against severe COVID-19 at reinfection. It's true people are getting reinfected, but are their reinfections severe? So we conducted a study to this end, and the results were really quite striking. And this cohort study covered the entire time from the beginning of the pandemic up to now. So it covered all variants we experienced in Qatar. And it turns out that the effectiveness of a first infection against severe disease at reinfection is 97%. It's very, very strong. So for those who had a first infection at any time since the beginning of the pandemic, they were very strongly protected at getting a severe acute COVID-19 at reinfection. So the vast majority of them got generally mild disease. Now, I need here, however, to stress two things. First, our population is quite young, so we really don't have lots of elderly population. Less than 10% of the national population are above 50 years of age. So this result really should be seen in the context of a young population. Even though in the sensitivity analysis we have done, it seems to hold also maybe a little bit lower, but it largely holds also for older populations. So this is an important actually caveat in this result. So this is about the protection of natural immunity. I will move now to vaccine immunity. Here we started our vaccination campaign at about the same time it started in the US, and using actually the same vaccines, both Pfizer and Moderna. As we were scaling vaccination, we had two waves, the alpha and beta, as I indicated earlier. So one of the first things we wanted to see is how effective are these vaccines against these variants. So we started with the effectiveness against alpha, and the results were really great because we found that these two vaccines are very effective. Pfizer was effective at 90% against infection with alpha. Moderna was effective at essentially 100%. So that was very good news that these vaccines are really strongly protective even against these new variants. We also looked at the protection against beta, and beta, as you may recall, is associated with some immune evasion. But despite this immune evasion, the vaccines worked really well. So Pfizer was protective at about 75% level, and Moderna was extremely protective at close to 100%. So this all showed that the vaccines are really working very well, even against these new variants. Now, you'll see also from these results, and this was consistent throughout, we saw that Moderna had higher effectiveness than Pfizer. So this encouraged us to look really for a properly controlled study to really compare these two vaccines. So we conducted what's called a control, what's called is actually a target trial. So this is essentially a retrospective randomized control trial. This is really what it is. So we do a very head-to-head comparison between these two vaccines. And when we did so, we had the same result confirmed that Moderna indeed is associated with 30% less incidence of breakthrough infection than Pfizer. The differences, however, against severe disease were actually quite minimal. So most really of the differences were just against infection. And we believe the reason for Moderna's higher effectiveness is because of the larger antigen dose. So Moderna and Pfizer essentially use the same really design, but Moderna's dose is 3 times as high as that of Pfizer. And this seems to resulted in higher protection. So all of these results were really great for the vaccines, where it was really optimistic times where we have the tools to confront this pandemic. But then we start seeing waning in the protection of these vaccines. And it happened, I have to tell you, really much faster than we expected, because by that time we were already looking at the protection of natural immunity, and it was really, if it's waning, it was waning very slowly. So we thought vaccine immunity will be the same. But it turns out that this is actually not the case, because we start seeing this waning for both Pfizer and Moderna. And within just few months, the vaccine effectiveness dropped to below actually 50%. So this was, of course, not good news at all. And this news even became quite shocking when Omicron was introduced, because these vaccines did not really work well against Omicron infection. So for those who are recently vaccinated, and this here result for Pfizer, they were protected at only 50%. So it's reasonable level of protection, but not the kind of protection we used to see against earlier variants of about 90% or so. And more distressing is that this protection was really waning very rapidly. So within 6 months, people lost their protection against Omicron infection. We're talking about very short duration of protection for Pfizer vaccine against Omicron. And by the way, the results for Moderna are quite similar. So all of this, of course, suggested we needed really to start with booster vaccination. Actually, we started even before Omicron, when we first saw the waning in vaccine immunity. And that was proved to be a very good decision, because indeed the boosters did restore the protection of both vaccines to a level of about 55% right after the booster. But again, the protection started waning with time, and eventually, actually, several months later, people lost their protection. But this all suggested really that we really need to keep boosting in order to have the best protection. And this was also confirmed by one of the studies we conducted right during the Omicron wave. So for those who got boosted, they were protected at 50% level compared to those with only primary series. So in this study, we compared people who got the booster to people who only had 2 doses. And definitely those who got the booster were substantially more protected. So their incidence was 50% less. And even better result is that they were even more protected against severe disease at a level of 77%. So really boosters worked very well to reduce the chance of severe COVID-19 substantially, which of course helped in reducing hospitalizations and of course death. Having said so, really most of the result I have been showing you is about the effectiveness against infection, not really about disease. We did see a bit of waning against the effectiveness against severe COVID-19, but really not much. No major really waning in the protection, even for those who had only 2 doses. The vaccines really worked very, very well in preventing the worst disease, even though they did not really work as well in preventing infection. Still, booster vaccination really substantially increased the protection, so it becomes much less likely for people to have severe disease at infection. So now I will move also to vaccine protection among children and adolescents. So recently we started also with children vaccination. So we recently completed a study to look for the effectiveness of the pediatric Pfizer dose. And as you know, the pediatric dose is substantially smaller than the adult dose. It's only 10 microgram versus 30 microgram. And we only started recently with children vaccination. So it was during Omicron time. And it turned out the protection is really quite small. It was only at 26%. I mean, clearly the Pfizer vaccine, the original Pfizer vaccine, and the same I would think for the original Moderna vaccine, are really no match to Omicron, especially so when the dose is small. We need really perhaps a stronger dose in order to protect against infection. But this is, again, protection against infection. Probably the protection against severe disease is much higher, but we could not really see this because the severe disease among children was so rare, we could not even estimate the effectiveness. But I would assume is definitely higher than the protection against infection. So these are for children. And in fact, not only the effectiveness was low, we really waned very, very rapidly for those children. It was strong in the first month at 50%. And after 3 months, it was completely gone. We're talking about very short-term protection for this small dose of Pfizer in children. For adolescents, we have been seeing consistent results that are very similar to adults. And we believe the reason for this because we are using actually the adult dose for children 12 and above, the 30 microgram. Very similar results against Omicron. Protection peaks at 50%, but then wanes, and within 6 months, it's all gone. So far, I have been speaking very much separately about natural immunity and about vaccine immunity. We have had lots of discussions since the beginning of the pandemic about these two immunities, which one is stronger, etc. So this also encouraged us to design a study where we compare head-to-head natural immunity to vaccine immunity. So we used also a target trial. So this is, in a sense, a retrospective randomized trial. And when we did so, we found that natural immunity is stronger than vaccine immunity. In fact, the incidence was reduced by about 50% for natural immunity compared to vaccine immunity. And this is for Pfizer. And the reduction against severe COVID-19 was even stronger. The protection was at around 75%. So natural immunity was stronger than vaccine immunity. In large part, this due to the more rapid waning of vaccine immunity compared to the slower waning for natural immunity. And this perhaps is due to the role of mucosal immunity in the protection. It looks like this might be the explanation for this result. So here is the result for Moderna, which was actually very similar to that for Pfizer. Now I will move to hybrid immunity of natural and vaccine immunity. I will show in one result because I think this result really captures very much what we have been seeing. This is against Omicron infection. What we have been finding is that 3 doses of vaccine plus prior infection is very strongly protective against even the immune evasive Omicron at about 80%. So in reality, even though many would argue about which one is better, vaccine or natural immunity, the truth, we need both if we have both, because the combination of both leads to the highest protection against infection, higher than the protection of natural immunity alone, and higher than the protection of vaccine immunity alone. And really, this should be seen in the context of a rapidly evolving virus. The virus is trying to evade immunity. So if we have more immune protection, the better it is. And this is exactly what really the results have shown. So now it has been over 2 years with this pandemic, and lots of people get infected, lots of people get vaccinated by different vaccines, and people get infected by different variants. So we have very heterogeneous immune histories in the global population. And this suggests, well, maybe now there could be new things appearing, like what's known as immune imprinting or antigenic sin, as some people would like to call it. So could it be that now there is so many immunological events in the global population, we could be starting to see immune imprinting compromising the protection against infection or even severe COVID-19? So this is one of the areas we are looking into it. And all of this work started also because basic science laboratory evidence started to suggest that this might be indeed the case. We have now studies suggesting that there is negative impact of immune imprinting on subsequent protective immunity for very specific immune histories, But this is really based on lab work, so still needs to be confirmed at the population level. So this is why we conducted recently a study to this end. And here is basically the study design. We compared two groups of people who got Omicron infection but had no prior infection, and people who had Omicron infection at the same time, but had also originally a pre-Omicron infection with either original virus alpha, beta, or delta. So I wanted to see whether there is any signal of immune imprinting here. If there is immune imprinting compromising the protection, we would expect the incidence among those who had two infections to be higher because their immunity is compromised compared to those who had only one Omicron infection. This is how this antigenic sin works. So we conducted the study, and what we found was exactly actually the opposite. Those who had two infections in the past, a pre-Omicron infection and followed by an Omicron infection, were more protected, had lower incidence than those who had only one Omicron infection. So it seems exposure to pre-Omicron variants followed by exposure to Omicron variants actually broadens the immune response and so increases the protection against infection. So we did not really find evidence that immune imprinting compromises the protection. But we looked here at only one very specific immune history, which I have just described here. It remains really to see whether immune imprinting could happen in other immune histories. We have very heterogeneous immune histories in the global population. And this is what we are working on right now, including immune imprinting for vaccination. So this brings me to my conclusions. So prior to Omicron, natural immunity and vaccine immunity showed strong protection against infection and stronger protection against severe COVID-19. However, the protection against infection, but not really much against severe COVID-19, waned with time, which will, of course, support the ground for more waves to appear in more as we go further into the future. Now, against Omicron, both natural and vaccine immunity showed only moderate protection against infection with Omicron subvariants. And this protection waned really rapidly. But the protection against severe COVID-19 persisted. It remained really quite strong, even though a bit lower, but remained quite strong. Overall, we're seeing that natural immunity is associated with stronger protection against both infection and severe COVID-19, and wanes also more slowly than vaccine immunity. But this is really just a relative statement. Both of them wanes, and both of them, it looks like the immunity will be completely lost within 3 years, if not, in fact, earlier. So really, we cannot count on immunity alone to protect us on the long term, unless we have maybe a new kind of vaccine, which that can induce really strong long-term protection. And so far, at least, we haven't seen epidemiological evidence that immune imprinting could be compromising protection against Omicron subvariants, which is encouraging. But again, this is just very initial investigation into immune imprinting. Last but not least, I just want to really acknowledge the large collaborative partnership we have here, which includes both the government and the academic sector, which allowed all of these studies and results to be generated. Thank you very much for listening and for the opportunity to present today.
Thank you so much, Professor Abu-Raddad. I think we have one question, or perhaps a second, depending on how we go. The question is, how do you know that initial infection is causing protection against severe disease at reinfection? Wouldn't that be an association? Couldn't it be that some people are not likely to get severe disease at all at initial or subsequent infections? Over to you.
Yeah, so I think the question is more whether we have a survival effect. So people, those who are really, really weak at first infection, they may actually have died. So they would not have lived to actually get reinfected. But really in our population, COVID-19 mortality was very, very small. Actually, it's very similar to Singapore. We only had less than 700 deaths throughout from the beginning of the pandemic. So I don't think this is really explains it. And in terms of severity, we do actually, and we started this from the beginning of the pandemic, we do not depend on hospitalization data for severity. We actually review every hospitalized case with COVID-19 every 3 days till discharge or death. And we allocate severity score based on the WHO criteria for severity. So, and we are able to track every infection in our population from the beginning of the pandemic. So we know whoever got reinfected, at least whoever had the reinfection documented with a PCR or rapid antigen test. So we are able to see whether this reinfection led to severe disease or not to severe disease. Yeah, I would say I think the results are quite solid in this regard. We see very, very strong protection against severe COVID-19 at reinfection. And this is, of course, at acute phase. I haven't really talked about long COVID. Maybe if we follow those patients, we will see, long COVID effects, but we haven't looked at this so far.
Thank you so much. We have a second question. Maybe we can try to have a short answer. Have there been studies on prospective mothers contracting COVID during their gestations and natural immunity passed on to the fetus? Over to you.
Yeah, I believe we only did a study on pregnant women to report vaccine effectiveness, but I believe actually there has been studies in this. In fact, based on US data that was published, I think just 3 months ago in the New England Journal of Medicine, where there was actually protection. Mothers actually passed their immunity to their newborns, which were more protected than actually mothers who did not have that vaccine immunity.
Okay, thank you so much.